Experience matters. Here's our track record. I started doing full arch surgery in 2003, 2004. I was doing my first full arch surgeries because I was trained by the guy who wrote the textbook. I went to Detroit, Michigan 6 times to learn exactly how to place a dental implant. But the way we did it then is drastically different than how we do it now. We were placing 8 parallel instead of 4, 5, or 6 at angles. So now it's way more streamlined. Gone are the days of 18 months until you got your teeth, 12 months until you got your teeth. Now you walk out the same day with those teeth, and tens of thousands of implants later, thousands of full arches later, over 20 years now. My mother married my very first full arch case, so I get to see that guy come in 21 years later. I still see the very first arch I did. And luckily, all the implants are still there and the bridge looks great, and he's in his mid-80s now, and it was the right treatment at that time, and it serves him very well today in his 80s. So tens of thousands of implants, thousands of full arches done. I've got the experience to be able to handle if heaven forbid something comes up. Stuff comes up sometimes, and you better have some experience. When they did a poll, they found out what variables affected the outcome the most. And it always comes down to one thing. That's the experience of the guy placing the implants. If he's got gray hair, if he's got the experience, he or she has that experience placing those dental implants, they can pivot. They know what to do to handle the situation. And that is the comfort you get in coming to us, in that I've got that experience. I know how to handle the situation. I've been there before.